CAD. Okay? So for next naman is intervention for your chronic congestive heart failure. So for congestive heart failure, same pattern. We're going to follow pattern 6D, that is for impaired aerobic capacity and endurance associated with cardiovascular pump dysfunction or failure. So what are your goals and expected outcomes? So there should be a physiological response to increased oxygen demand is improved. Kaya diba, congestive heart failure, it also affects your pulmonary system. So there's actually an imbalance sang pag-deliver sang oxygen to the different parts of the body. The same with sa pag-pump sang imo nga blood. So dapat there is there is a change. There should be a positive change. So also, the patients should learn how to self-manage of symptoms, no? Para mag-improve siya. And then, the ability to perform physical tasks is increased because patients who have congestive heart failure, especially if ang affected is the, sa pulmonary, lasig siya kapuyon. So, hindi siya ka-perform sa mga physical tasks. So, isa na sa mga goals na nga dapat after sang rehab, kumbaga, madako ng threshold sang iyang cardiovascular endurance. So also behaviors that foster healthy habits, wellness, and prevention are required. So same man CAD, no? So more on lifestyle change. Disability associated with acute or chronic illness is reduced. So, di ba sometimes patients with CHF, no, nabulayan sila mag-perform sa mga activities of daily living. Instead, sang una, makawalk pa sila from their room, outside their house. Subong, hindi na nila kaya mag-walk from their room to their bathroom because of the effect of their chronic illness. So, ang aton nga goal is for them to regain at least, an increase sa ilang current activities, sa daily activities nila. Next is the risk of secondary impairments is reduced because, diba, like I said, when you have a cardiopulmonary problem, it will affect all the other systems of your body. So we don't want that to happen. So as much as possible, as early as possible, we want to reduce that occurrence. So we can reduce those by lifestyle change and of course performing the prescribed exercises for our patient. Next is awareness and use of community resources is improved. So more on community na siya. And then performance of and independence in ADL is increased. So basically, ang goal tagid with rehabilitation is to improve the quality of life of the patient. So how do you improve the quality of life the life of the patient? So of course, it will have to include independence kid. So, diba, if you are independent, mas free ka, mas feel mo nga, mas mayo imo nga kabuhi kaysa sa nagadepend ka lang on other people, nagadepend ka kung saan ka nila pakanon, kung saan ka nila pahulagon. So, of course, dapat ang goal si patient, dapat independent siya in performing his or her activities. Okay, so as exercise prescription, so this is a multi-system approach, because affectation of your CHF is multi-system also. So it should include peripheral endurance training. So ang mga muscular endurance of your mga upper extremities and then the lower extremities. Low level resistance training, so you can perform mga 1 pound free weights or elastic bands, and then respiratory muscle training. Of course, this should be done along with systemic conditioning. So, of course, dapat i-increase mo man ang cardiovascular endurance ni patient. Okay. And then, you start when there is compensated CHF na. So, stable na si patient. Okay. Next is aerobic exercises. Okay. Excuse me. So, low intensity and gradually increase duration as tolerated by patient. So, you start from the lowest intensity. So, hindi ka nga gulpyada i-ano mo dahil sa patient. So, for aerobic exercises, of course, we should start with a 5 to 10 minute nga warm up, and then you gradually increase to the aerobic activity, and then you gradually decrease na naman liwat for cool down. Okay? So, your intensity should be monitored through the use of dyspnea, so such as your talk test, and then your RPE. So, fairly light lang dapat si patient, or pwede siya somewhat hard. Basta within 11 to 13. Okay? Liwat-liwat, 11 to 13, di na dapat malimtan. Patients with congestive heart failure are usually on beta blockers. So, pharmacological management of your CHF, di ba, included ang beta blockers. So, your beta blockers alters your heart rate. So, this is not a good indicator of intensity ang imong HR. So that's why you should use your RPE. So the best indicator for intensity is your RPE for patients with congestive heart failure. Also, take note, if there is a drop in blood pressure, this means that the heart cannot maintain your cardiac output during exercise. So, nagnubo siya ang blood pressure because hindi na siya ka-sustain sang volume of the blood nga kailangan niya ipagwaon. So, take note of this. If nag-drop na ang BP niya, meaning you need to have the patient take a rest. Okay? Or you can end the activity altogether. Alright. So, what are the criteria to terminate the exercise? So, ano ang mga scenario wherein you have to stop gidya. Hindi nga iparest mo lang sa patient, kundi dapat i-stop mo gidya ang exercise mo. So, if there is a marked dyspnea or fatigue, so if hindi, grabe na gid ang hingal-hingal ni patient, or if you have ang O2 sat nga gadget, so you can use that para makita mo if kamusta ang oxygen saturation pa ni patient. And if RR is greater than 40 breaths per minute, there is a development of an S3 heart sound. Okay? There is an increase in pulmonary crackles. So that pwede na siya if you are performing auscultation. There's a decrease in heart rate or BP of greater than 10 BPM or 10 millimeters per mercury, respectively, during steady state or progressive exercise. There's an increase in CBP by 10 millimeters of mercury. And of course, as you can see sa ocular inspection, makita mo si patient, may diaphoresis, gina-cold sweat siya. There is pallor, nagapalamuti si patient, and then makita mo sa face ni patient, confused siya. Confused siya because there is less volume sang blood nga gina-pump out sang heart. Okay? So how about to initiate the exercise? Paano ka kahambal nga pwede ka naka-perform exercise or cardiac rehabilitation for a CHF patient? So if there is a compensated CHF na, and the patient can speak comfortably without signs of dyspnea with RR less than 30 breaths per minute, less than moderate fatigue, CI for greater than 2.0 liters per minute, CVP of less than 10 millimeters per mercury, crackles in less than 1/2 of the lungs, and then the resting heart rate of less than 120 BPM. So for this one, siguro, ang kaya na maubra on-site, is sa chart, makita ta na if compensated iya nga CHF. This one, pwede ta na magamit. And then this one, siguro, pwede ta na sila magamit. Insigida lagi on-site. Okay? To know if we can initiate the exercise. So next, strength training. So strength training is important for congestive heart failure. So this is a very crucial component of exercise plan for your congestive heart failure patient. Why? Because kulang gani, di ba? Especially if ang affected man ang lungs, so kulang ang oxygen, di ba? Ang oxygen na output. So kailangan mo nga may endurance si patient. Okay, so dapat pati ang muscular endurance of the upper extremity and the lower extremity dapat good gid ang ilang muscular endurance for CHF patients. Hindi pwede nga low ang ilang endurance. Okay? And we can do this, no? We can start our strength training by introducing light resistance such as light elastic bands and light weights such as 1 pound, 2 pounds, no? So, ang 3 pounds actually medyo moderately heavy na siya. Okay? And of course, we can perform ventilatory muscle training. So I hope you learned this one from your pulmonary rehabilitation na ventilatory muscle training. So because kay CHF, usually affected ang aton nga pulmonary system, we can make use of the breathing exercises wherein you breathe through your nose and then exhale through the mouth. So pwede siya diaphragmatic breathing. Or you can also use your pursed lip breathing wherein you slowly exhale the air through your pursed lip. Okay? And then, of course, inspiratory muscle training. So, this is actually moving away the work from the sa aton nga inspiratory muscles and then moving it to the abdominal. So, more on ang abdominal sa nag-perform sang ventilation for the patient. Okay. Next, is activity pacing and energy conservation techniques. So for patients who have cardiac conditions, so nubo ang ilang cardiovascular endurance and the muscular endurance overall. So what do? We perform conservation techniques. So basically, gina-shortcut ang mga activities ni patient. So wala to siya ginapa full exercise gid. So what can we do? So first off, we can decrease the workload ni patient. So instead of performing the whole sequence nga, let's say for example, kailangan niya gid perform 30 repetitions, pwede ta anay nga i-cut down ang balot si patient. So for the first few days of our rehabilitation, you can perform 15 reps lang anay muna. And then you can recommend frequent rest intervals before they get tired. So take note guys dapat before siya magkapoy si patient. Hindi nga pagkakapoy niya muna pag rest nyo. So dapat before. Okay? And then you can ask the patient to participate in activities that require greater energy cost at times of the day. So pwede siya in the morning, kung mas damo ni energy requirements sa morning activities such as mga greater energy requirements, like climbing the stairs, so aga niya obrahon, okay, or at the end of the day, okay, para hindi siya kapoy kay patient, nisagad siya sa kapanaog sa iyang stairs. Next is planned activities ahead to avoid and delegate some to others. So more on sa home setting, so kung may mga ulobrahon si patient, pwede na nila i-work out, okay, may list sila of activities na pwede obrahon ni patient. Okay, alternate easy and difficult tasks with rest intervals. Okay, so hindi nga ang tanan nga difficult task sa isa lang ka setting amuni and then karon naman ang easy task. No, what we should do is easy nga task and then difficult task and then easy task, ibalot-baloton ta. Next is you can adjust your environment to make tasks easier and sit when feasible while doing strenuous activity. So this one, di naman kasulod si ergonomics. So pwede gid actually nga i-modify ang settings sang workplace ni patient or settings sang iyang mga activities of daily living. Okay? Para easier for him to access the things that he need, and he doesn't need to exert a lot of effort to be able to acquire something. So for education for patients with CHF, of course, activity guidelines. So kagina, mga activities na pwede tayo hatag kay patient. Okay, self-monitoring. So like I said, you can teach the patient how to take pulse palpation, or you can teach the patient how to perform a rating of perceived exertion. Okay, sa self niya. And of course, you can teach the patient symptom recognition and response. Okay, nutrition niya. What are the food that he should eat? What are the food he should avoid? Medications. Actually, medications no can be educated by the nurses or the PCP mismo. So if may nabalaan kita, ensure kita, we can actually impart man our knowledge to them. Okay, and then lifestyle issues, very important because lifestyle issues has more effect on prevention, okay, rather than cure. Okay, and of course with cardiac problems, the best idea is prevention. Okay, so that's it for your cardiac rehabilitation. So focus more ang cardiac rehabilitation no is more on CED, MI, and CHF. Okay? Because the rest actually the same presentation lang man na sila. Okay? So for cardiac rehabilitation abi guys, though uniform siya no kung ano ginobra mo sa phase 1, ang muna obra mo sa phase 2. And actually you have a phase 3. So ang phase 3 wala siya sa kay wala siya kay O'Sullivan. But your phase 3 is actually community rehabilitation na. So when the patient is negotiating no sang activities outside his home, okay, which is actually very very self explanatory no ang community rehabilitation. So dapat kumbaga si patient very stable nagid katama to negotiate the outside world, or let's say for example